It was a busy afternoon in the hospital when Sarah, a medical student, was called to assess David, who had suddenly fallen ill. His wife described his symptoms: explosive watery diarrhea, sunken eyes, and dry skin. Sarah knew she had to act fast. This looked like cholera. Cholera, which is caused by Vibrio cholerae, is common in areas with poor sanitation and unsafe water. David's recent travel to an outbreak-prone area put him at high risk. Cholera spreads rapidly through contaminated food or water. Immediate treatment, following WHO and CDC guidelines. Sarah saw David's blood pressure was dangerously low. He was in hypovolemic shock. The first step was immediate rehydration, oral rehydration solution, ORS. ORS, a simple mixture of water, salts, and sugar, could restore vital fluids. David's severe condition required IV fluids, Ringer's lactate. Sarah and the team started administering IV fluids immediately. Antibiotics. Shortening the duration. Rehydration is crucial for cholera treatment. WHO recommends antibiotics in severe cases to reduce diarrhea duration. Doxycycline, single dose for adults. Azithromycin for pregnant women and children. Sarah prescribed doxycycline for David, reducing his illness severity. Antibiotics don't replace rehydration therapy. Replacing lost fluids is vital. As David's condition improved, Sarah and her attending discussed ways to prevent cholera for future travelers like David. Sarah learned that currently there are 3 approved vaccines against cholera. Vaxchora is the only FDA-approved cholera vaccine. Vaxchora is a single-dose oral vaccine that should be taken at least 10 days before traveling. Recommended for people aged 2 to 64 years. Reduces the risk of moderate and severe diarrhea by 90% at 10 days after vaccination. The vaccine is at least effective for 3 to 6 months and is ideal for travelers like David. Furthermore, Sarah learned about the 2 vaccines recommended by the WHO. Dukoral is recommended for individuals aged 2 years and older and is administered in 2 doses, spaced 1 to 6 weeks apart. However, children aged 2 to 5 years require 3 doses of Dukoral. Vaccination is effective for 2 years. The other WHO-approved vaccine is Euvichol-Plus, or Euvichol, which requires 2 doses, administered at least 2 weeks apart. The vaccine is recommended for individuals older than 1 year and provides protection for at least 3 years after the 2 doses. These WHO-approved vaccines are vital in outbreak-prone regions, especially in low-resource settings where cholera is endemic. Remember, preventing cholera is not just the responsibility of travelers, but of everyone in the community. Together, we can make a difference. And don't forget to like, share, and subscribe for more important health information.